But Daz, everything else seems to be running on time.
I feel whether I might be coming down with something. Boy, I wish we had some expert in the studio with us to be able to talk to us about flu season and colds and so forth. It'd be really handy, wouldn't it?
Well, ask and you shall receive, my friend. I'm very, very excited this morning.
We are very excited because we have Dr. Poole from Health Medical Centre joining us this morning. Good morning, Dr. Poole.
Good morning. Thanks for having me. It's really great to be here.
Kind of like, and I've stolen your intro there a little bit because I know you do introduce yourself as Dr. Poole to
right.
a lot of your clinic visitors.
Yeah, we like to make people feel welcome and comfortable, and I think Dr. Poole is a little bit formal, so Dr. Poole, happy to be called that.
We've got a first name basis now. We're good friends here.
That's right.
Health Med. Now, before we've got a few questions here. A lot of stuff that we'd need to cover because we're coming up to flu season. It's very important that people get the right information. Can I just say though, unless we've got your disease, I'm going to say.
When did that happen?
Can I just say?
Yes.
I've been listening to you far too long.
Go ahead, Daz.
Mighty impressive with the clinic.
Why, thank you.
Mighty impressive.
Yes, our clinic is quite revolutionary compared to what your standard GP setup might be. In fact, I think no other clinic in Australia is doing what we're doing in terms of having a really welcoming, comfortable waiting space, really friendly staff, and just a really positive experience for patients to come in and get help with their general practice needs.
I've moved in.
Have you?
Yeah.
I can see you doing that.
You need box help. Did you play the NBA there on the weekend so you come watch some NBA games in the lounge area?
No, I miss the NBA.
Yeah, I miss it too.
Dr. Poole, please don't go and get Foxtel because he'll never leave.
I won't leave. Now, I think, what is the flu and how different is the flu from just catching a cold?
Yeah, I'm glad you asked that because it's actually quite a common thing that I see with my patients, day to day during flu season is that we get a lot of people coming in sick and often they don't know, do they have a cold, do they have the flu, what's going on, what's the difference? So the way I explain it is there's lots of different viruses out there and colds are one type of virus, flus are a very different thing. So when you get a cold, it starts off usually with a bit of a sore throat or a tickle and then you get a bit of a runny nose. You might notice a bit of a cough, maybe a mild temperature, and you feel a little bit unwell for maybe 5-6 days before you get over it. Now, that's not too bad. Flu, very different. When you get sick with the flu, you're out of action for a week. Usually 5 or 7 days, you've got the aches and pains all over, you're feeling really tired, just really miserable, can barely drag yourself out of bed. It's a much more severe illness than a cold, and in fact a lot of people die each year. Over 700 Australians died last year from the flu alone.
Wow, that's a little confronting. We are approaching winter, it's that time of the year, so what should I be doing, Dr. Poole, to avoid getting the flu this season?
Yep, I'm glad you're thinking ahead because often prevention is the best way of dealing with the flu. Unfortunately we don't yet have a cure, so there's a lot of strategies I advise my patients at Health Mint in terms of how can you avoid getting sick. And one of the best measures is getting vaccinated against the flu. We recommend it for everyone every year. But that's not the only thing you can do. So it's important that you stay away from other people when they get sick. If you see someone who has cough or cold symptoms, stay well away, wash your hands carefully so you don't get their germs. It's also important you're looking after yourself, getting lots of sleep, as well as looking after your mental health, because if you're feeling stressed or run down, you're more likely to get sick. And there's certain vitamins you can also take to help boost your immune system and keep you healthy and happy.
I'm never sure. Every year I'm never sure whether I should get the injection or not. So whether it's a category of older people or pregnant ladies, or what sort of people should be looking to really safeguard themselves and get the flu vaccination?
Yeah, so I get a lot of people asking me, should I get the flu? Should I get the flu vaccine? You don't want to get the flu. And so I say to them, well, there's certain groups of people that we particularly recommend, but really it's a good idea for everyone because, we mentioned that the flu is a pretty nasty virus to get, and the more people that get protected against it through a vaccine, the less likely everyone else is to get sick. It's going to help our community.
So how does this injection work? Because I've heard that if you have the injection, it can actually make you sick. So I'd love you to put this to bed for me.
Yeah, it doesn't make you sick with the flu, although some people can feel a little bit unwell afterwards, and I'll explain what I mean by that. The way we make these vaccines is we take what was the flu virus, but we then weaken it so it can't make you sick in the same way the flu virus can. It's a bit like, if you think of the flu like an army of soldiers, we take that army, but then we take away all the weapons. So they still look like baddies, but they can't, attack your body like before.
I'm excited because Dr. Paul's explaining this to me like I need to know.
Like you're 5.
This is great. I often say to Dad, speak to me like I'm 5. This is awesome. Thank you.
My pleasure. So we've taken this army of soldiers. They're weaponless. They can't hurt you, but they still look like the baddies. And then we show that to your immune system, and your immune system goes, aha, I recognise these guys. I'm going to be prepared. And that way, when the real thing comes along, the real army with their weapons, your body's already prepared. They've got an immune response. They'll be able to fight it off before you get sick. Now, having said that, some people do get a little bit unwell just after getting the flu vaccine. Usually it's pretty mild, like a few aches and pains, maybe a bit of a temperature, which might just last a day or two, and usually a lot less severe than getting the flu. That's actually a good thing. Usually those symptoms is part of your body's immune response. It's sort of your body telling you, yep, it's getting prepared.
Did I read somewhere that the government have released like a super version of the vaccine? Is that right?
Yeah, that's right. I mean, this is a pretty new thing, and it's quite interesting because it's the first time we're getting it this year, where, I mentioned that last year's flu season was particularly bad. And so the government's trying to work out, how can we help protect people going forward? The last year's flu vaccine didn't work quite as well as we would have liked, so how can we do it better? So some clever scientists have looked at how they made the vaccine and basically made a souped-up version of it. They've taken what they normally put in it, the flu virus, they put in 4 times as much, so it's like 4 times as strong. And that will particularly help people most at risk, including people over age 65, people with chronic health conditions who previously wouldn't have found the flu vaccine as effective for them. This year, hopefully it'll work a lot better.
Interesting. So, look, the reality is that I may get the flu. It's not going to stop it. But if I do get sick and I do get the flu, what do I do?
Yeah, as much as we try to avoid it, sometimes it's just too hard to and we do succumb. But there are things you can do at home to look after yourself. And the most important thing, even though it might seem obvious, is rest. I know it's really hard if you're busy with the day job, if you're a parent, but it is important you rest, both so that way you can save your energy, for fighting off this infection, but also so that way you don't get everyone else around you sick. Because if you got sick with it, it means someone gave it to you, and you could give it to everyone else if you're not careful. And on that note, it's important you also wash your hands carefully because it is spread through droplets. So by staying away from others, washing your hands, it's going to help prevent spreading it. Apart from that, it's important you look after yourself. So you can take cold and flu medicines, lots of options from over the counter at the chemist. I also take vitamins when I get sick. Vitamin C and zinc can help boost the immune system. And it's really important you stay hydrated because hydration can also help boost your immunity, help your body fight off these infections.
I also hear that the government are releasing a superhero version of the flu vaccine for man flu. Because we all know, Paul, you know as well as I do just how critical it is to your health for man flu and just how that knocks you out completely.
Yes, I'm afraid I can't talk about that a lot. It's quite top secret at the moment.
Yeah, good. You and I will talk off air about that because we know.
I think you and I, Daz, should go and get the flu injections. I think we need to do that. I think it would be good for both of us. I think it's something that we need to make that appointment. And I think, ouch, I'm scared. It's scary. It's not scary.
It can be scary. Well, I try not to scare my patients. We try to make them comfortable and relaxed in our environment at Health Mint. But look, I think it's worth getting. It's a very quick jab. It'll be over before you know it, and I think you'll feel a lot more peace of mind once you get protected.
Let's make sure we do that.
I was going to say, if I'm going to get it, I'm definitely going to Dr. Paul because I feel like I've got that trust already. And
because he's got dreamy green eyes.
I did not say that.
No, I didn't have to. Just the way you're staring into his eyes.
No, because I feel like I will just say this as well. There's plenty of doctors around the southeast of Melbourne, and to find a doctor who is genuinely interested in symptoms and what you're doing. Daz, don't look at me like that. It is actually a really, really good service. So if you haven't been down to Health Mint, certainly have a look on their social media as well as they are. There's so much stuff. I'm yet to come in to see you guys, but I'm looking forward to doing so because Daz is moving in over there.
Lovesick. She's lovesick. You got anything for love sickness?
I have not.
Still working a cure for that one, but we'd love to have you down, when you get the time. And also, we're interested in knowing what our local community wants to know about in terms of health topics. So if anyone listening, if there's something you wanted to know about, feel free to get in touch with us through private message. We're on Instagram, on Facebook. You can contact us at Health Mint. And we're happy to help the local community.
I kind of fallen in love with his voice a bit too, Dr. Paul. Health Mint Medical Centre, they're at 210 William Thwaites Boulevard, Cranbourne North, 5611 3365. Jump onto healthmint.com.au. As you just said, you guys are very active on social media, so there's plenty of ways that they can reach out and touch base with you. Most importantly, make an appointment, come down and get that flu vaccine for 2018. Make sure you safeguard yourself. Dr. Poole, thank you very much for joining us on Extra